This video is about yoga and how it can help you with vaginismus and painful intercourse, and how it can help you to have a better sex life, and especially a nice sex life, including if you want it to have nice intercourse also. This is the video. That is where the video is about. For those who do not know me, I am Jacqueline from the Bilt. I am a coach for women with vaginismus now for about 70 years, and I started when I overcame my own vaginismus. I was already a coach for many years in the Netherlands, but then I took I wanted to coach this woman because I got sort of in a mission, like I didn't want any other women to have the same difficult, lonely road that I went to overcome my vaginismus. And I wrote my own book. This is the book, How to Overcome My Vaginismus, How to Change the Sexual Experience from Painful to Pleasant. And today I have with me Brianna, and I follow Brianna on YouTube for many years now because she is a really great physical therapist and also a yoga instructor. But she does it in a holistic way. And I think that her approach is really nice. She's really cheerful and she explains in detail. And I think that is really important. She explains in detail how you can do the exercise and where it is good for. So today, Brianna, can you introduce yourself a little bit more?
Yes, absolutely. Thank you for having me and inviting me to do this conversation and chat. I am a pelvic floor physical therapist. I have been practicing physical therapy since 2006. And most of my work that I do now is online. So I have a YouTube channel, and then I have online programs and courses that help women with pelvic floor issues such as pelvic organ prolapse and incontinence, bladder leakage, and also pelvic pain. So vaginismus, as well as, all types of painful intercourse and all sorts of reasons people can have pelvic pain and discomfort. And my real interest is in the mental and emotional work of pelvic health, the mind-body connection, and how our stress levels, our fears, our anxieties can impact our pelvic floor. And yoga is very, very helpful for all of that, as is working with, the mind. And that's one reason I really resonate with your work, is you really bring a lot of that in.
Yeah. And I think that the way you explain everything, but also the mind and the body connection, and also the way you say the words out loud. So I noticed that many women, also pelvic floor therapists in the Netherlands, it's a little bit difficult to say intercourse or penis or vagina or whatever, that kind of words. Some people think it's really difficult, and you just mentioned that it is normal. And I do the same because it is normal. I think it's normal. So that is also something that I found really nice about you. You don't put different words for it. You just say what it is. I think it's good. I think it's good.
Thank you. And actually, that's one thing I really enjoyed about your book in taking a look at it, is that you really you just use real words. You go into detail. Like, it's real life information. It's very detailed and explicit, but I mean that in a positive way. Like it's detailed and do this, try this, and it's very real life. It's not sugarcoating anything or being wishy-washy or kind of vague with terms. You're just very try this, in a very polite way that is gentle, but it's also detailed. I really like that. Mm-hmm.
And thanks for the compliment, because I hear a lot from friends of mine. They say, Jacqueline, do you have to write all those details in this book? But yes. I noticed with my own experience when I overcome it, that especially the details I didn't know. And that's what I hear from many women who come to me for so many years now, that they say immediately, they say the first time they come with me, they say, you really know what you're talking about. And the way you explain it, now I dare to try. I know how to try. I know the details because how you explain it. So I think it's really important. And I also want in the book to get so many women feel so ashamed about what they have. They feel so alone. And I felt also. So that is why I try to be really open about my own story. It was not easy to do, but I thought nobody does it. So somebody has to do it, then I do it. And so I think that is really important, the details, and especially the soft way how you can do the steps.
Mhm.
And
Yeah.
I remember that I had to write the topic of the different parts of our genitals, and then my one of my friends read what I wrote, and she said, "Get it out, put more Jacqueline in it," because it was too medical. And then I
Yes.
put it like this. It is not a medical, it is not in a medical book. The way how I speak is how I wrote it. So it's, yeah, I'm proud of my book. Yeah, I'm proud of it.
You should be. Mm-hmm.
Yeah. And what kind of practical experience do you have with vaginismus
Well, my practical
and
experience,
yoga? Yeah.
yeah, so I don't personally experience vaginismus. I have not experienced that exact condition. Now, I do have experience with excessive pelvic floor tension, tightness in the muscles, and constipation, issues with a lot of tightness in the pelvic floor that comes along with stress. When I'm stressed in my life, I get a lot of tension that causes other types of pain. But I've never had vaginismus myself, where I'm unable to insert a tampon or a penis. It's not something I've personally experienced, but I've worked with a lot of clients who
Yeah.
have. And
Yeah.
so I worked with clients in person and helped them through their vaginismus. And then I've worked with clients online and have helped them.
Yeah. And do you have a special interest also in vaginismus and painful intercourse?
Well, yes. I mean, one of my first stories that I ever ever had the joy of working with as far as client care when I first got into pelvic floor physical therapy was a woman who had vaginismus, and she had just gotten married. She and her husband, new husband, had been virgins before marriage, and they were completely unable to have sex, but they
Yeah.
wanted to, and she wanted to have a baby. And with her, through our work together, she was able to ultimately get pregnant. That's the nutshell
Yeah.
version. Long story, very short.
Yeah.
It wasn't overnight, but she was able to have a baby. And that was kind of one of the first stories of like, wow, this work that you and I do, and pelvic floor physical therapists and providers all over the world can do, it literally changes lives. It changes
Yes.
lives to be able to help people have intercourse. It seems like such a, maybe it feels like a frivolous thing, but it's not. It's a really, really big deal. So that's kind of what drives me and keeps me going.
It is nice what you say because in the Netherlands, I was in a television program, and some really good gynecologist said in the program that he thinks that the clients make the intercourse too important. And I was sitting at the table and I was thinking, what am I going to say now? Because they invited me because of my experience. And then I said, you're totally true. If you can have intercourse, then it's not important. Then you can see it as a part of, you can do everything, all different kinds of things with sex. Sex is not only intercourse, it is with all the things you can do. But if you cannot, then it can influence your life in many ways. Once I had a client, she was 53 when she came to me, and her first experience with intercourse, trying to have intercourse, was really clumsy. She was young and the boy didn't know anything. It was clumsy. But after that, she never dared to have another boyfriend She did not have children, and she really would love to have children. And at 53, she came with me, and she felt so sad. She said, "Oh, should I have come so many years ago? Then maybe I could have children." So I think that is one of my saddest stories, of a woman, what it can do to your how you feel about yourself, how you can relate to men. It's much more than people ever can imagine.
Right.
Think
Yeah,
that,
and you're right. If it's not a problem for you, you won't
yeah,
think it's a big deal, but it is a big
exactly.
deal. It's a very
It's,
big deal.
yes,
And I
yeah,
mean, even just people minimize the importance of pleasure.
yeah,
Pleasure is very important to
yeah,
the human experience. And
yeah,
especially these days with the world, so so many things going on in this world, and we
yeah,
all need tools to manage stress and to just feel better, to get us through. Because let's face it, things are tough in the
yeah,
world at
yeah,
large. So,
yeah.
yeah,
And I think that is why I for my goal, when people come, when women or with or without a partner, it doesn't matter, both can
yeah,
come. Then they say they want to have intercourse. I said, yeah, can we change this a little bit? And you have nice intercourse as part of what you all can do in your sex life,
right,
with yourself and with a partner.
right.
Because I think when it's only intercourse, it's too you cannot have intercourse like come in and go inside of me. It's not possible. The woman's body is different. You have to take time, and I think that is. And then they say, oh, and I said, and it can be nice and
Yeah,
pleasurable also. They cannot imagine, because nothing can get into our body, so they can't even imagine that it can be nice also.
right,
So,
right.
and what do you think about yoga is really nice to do when you have pelvic floor in general, and also a little bit about vaginismus, but I think it's sort of the same.
Yeah,
But yeah,
yeah.
what?
Yoga and so yoga is, of course, a big term that includes
Yeah,
not just the stretches and the physical poses. It also includes, mindset and breath work and lifestyle and a way of living life. So when I refer to yoga, I would really be referring to yoga asana, the yoga poses
yeah,
and the
yeah,
yoga stretches. And that can be wonderful for people who have vaginismus or really any type of pelvic floor issues, because you're, of course, moving the muscles, you're stretching them, you are activating them. And what I really love about yoga is it tends to be yoga asana that I teach, tends to be more of a slower
yeah,
mind body relaxing practice rather than a fiery, powerful workout, right?
yeah,
And
yeah,
both are wonderful. I think fiery, powerful yoga asana workouts are great. But for pelvic pain and pelvic floor tension and vaginismus, I'm really focused more on the relaxing yoga and the stretches that really open the hips and the pelvic floor muscles themselves. And I have a little model here that I love showing. It's just a really cool model that shows the pelvic floor muscles, the inside, if you're looking into a pelvis, down into the pelvis. And then this would be from the outside, the outer muscles, looking at the more external pelvic floor muscles. So this is as if a woman was on an exam table getting an examination from her physical therapist or her gynecologist. And this would be the anus, and this would be the vagina. So these outer little muscles here that surround the openings and go between the sitting bones and the pubic bone, all those tiny little muscles are part of the pelvic floor. And these muscles are usually the ones that are tightening up when vaginismus is happening. Of course, the inside ones are tightening up too, but these
yeah,
outer muscles are like the first responders. They're the muscles that often, if we have trust issues or fears or boundary issues, maybe our boundaries have been crossed in the past, or just it's so painful. And so we're scared. And so these muscles are going to tighten up. And these muscles that I just pointed out are part of what we're opening and stretching with yoga asana, that is about release of the hips, the whole pelvic area. I mean, really any yoga move that's opening and stretching the hips is going to ultimately impact and stretch these muscles, as well as on the inside. You know, when a person's doing an exam, these muscles here are still your part of your pelvic floor. And I won't get in, it doesn't matter the names. I mean, it does matter, but not for the purposes of this interview.
No.
You know, it's just to say there's a lot of muscles that make up the pelvic floor and the pelvic area. It's not just one muscle, there's lots.
Yeah.
And when you are stretching and relaxing and breathing through yoga poses, it's stretching and opening and relaxing all of those muscles that tighten up and clench up when vaginismus is a problem.
Yeah. And what I think is nice of your exercise is that you stay a little bit longer than normally in yoga poses. And for me, the word stretch is also always a little bit, how do you say, when the women with vaginismus come with me, then many times they've heard that if this is the vagina opening, that they had to stretch like this. And so the mind thinks like stretching painful, because this is not a good way to open up your vagina. And so I always say and explain it like the stretch is not like the stretch, it is the relaxation of the muscles, and because of the relaxations they become a little bit longer and it opens up. It's just a matter of what I tell them, because of the stretching is painful, relaxation is nice. So that is the difference. And what you do is exactly that, because you say in the videos many times, relax, breathe into it. So the end result is that all the muscles become a little bit longer, and that is what is necessary, because then they can they can have more relaxation at that time. Yeah. And what it's just in this time that I work with a woman and also with myself, it's the same as when people say, I want to I want to put a penis inside, so a finger or a penis inside. I always say, you want to allow the penis inside in time that the pelvic floor muscle needs to relax. And I found out that when I say, with all the techniques that I have, when I say that, then immediately I see like a sort of relaxation in the face. Oh, it's not the finger who gets something. No, it is you decide what the time is.
Right.
And I think many women are not used to taking that good care of themselves. But I think that is important.
Really important. Yeah. I love
that
idea of allowing it. It also reminds me of it can be hard for people to hear the words relax, because sometimes that in itself even sounds like a command. Well, I can't relax. I don't know how to relax. And so I do like the idea of allowing or softening or receiving, or softening is one that really I enjoy. I love the idea of just softening, or muscles kind of melting away from the bones, just reducing some of that resistance, because it can feel, again, like a command if you say, just relax. But allowing a penis in, or softening, or receiving, those all feel a little bit better, or just dropping into the body, breathing into that area. I love imagining a tiny set of lungs in the body part you're trying to work with. So for example, imagining a tiny set of lungs in the pelvic floor area, or in your hips, or in your vagina, or in the anus, a tiny set of lungs in that area, and just breathing into those lungs can feel really nice. And that way you're naturally going to relax without having that kind of stress of the command of relax. but I don't know
Yeah.
how to relax. It's like, no, just imagine the lungs in that part of your body. And that can be really helpful too.
Yeah, that's true. I think that is, and also words like what you say with the lungs and breathe into it.
Yeah.
Sometimes people feel also that a little bit strange, but the way you explain it,
Yeah.
then it makes more sense. Not only for me, because I just like to do the exercise you gave.
Mm-hmm.
It's
Mm-hmm.
just because I get the how do you say in English? That I get more flexible
Mm-hmm.
and I get relaxed at the same time.
Yeah.
That's why I follow you and do the exercise. Um, and what I found out for myself that even when I can have intercourse, that some of the exercise you gave that it's sort of hurting me in my bottom at the side of the bottom.
Mm-hmm.
So I think it's because I was so many years, I had vaginismus, so I was so cramped in the whole pelvic floor that even now, after all these years, still there is a little bit left. So it's not necessary to be relaxed all to have intercourse because I can have it. But by doing the exercises, then I notice that it becomes less
Mm-hmm.
painful to do it, especially because if you do it softly, so not like yes, I have to do it 100%. I have to do it like you do it, like how you sit. I can never sit like you. I have a totally different figure. I have totally different body. It's not necessary. It's like you give the explanation and you can see how you can adjust to the exercise and give yourself time.
Yeah.
Give yourself time. Yeah.
Right. Right.
And what are you think maybe 3 or 4 best, or maybe you cannot say best, but good exercises to relax, get more relaxed in the pelvic floor area?
Yeah. I think there's so many, but a really great one is child's pose and also puppy pose. I actually love puppy pose. So for anyone who doesn't know what those are, child's pose, well, let's see, how do I describe this? Maybe you could, I don't know, maybe we could have a picture or something like that. But
Yes.
basically
Yeah.
your back and your arms are forward in child's pose. Now, why I like puppy pose, which is when your hips and your butt are up above your knees and your arms are down on the floor, but your hips are just right above your knees, is that in that position, I feel even more this spread between my sitting bones, my butt bones, which again, these muscles or these right here are indicating the sitting bones, the butt bones. And you
Yeah.
can see right in between those are some of the external pelvic floor muscles. And then, of course, all the muscles inside as well. So when you're opening those sitting bones apart, which I can really feel, and you can really imagining them open apart when you're in that puppy pose, you can even play with your hip rotation a little bit and turn your knees in and your feet out. And that internally rotates your hip and opens those sitting bones apart even more, just kind of playing with that. That's a really nice way to really feel that release of some of those specific pelvic muscles. But then you're also releasing your back and your glutes and other bigger muscles that feed into the pelvic floor as well. One big thing is that the pelvic floor muscles that we talk about and these muscles that get so tight in vaginismus, they don't exist in isolation. So kind of like you were saying earlier, it's not just about putting in a dilator or just going straight to the specific the vagina and the specific muscles around the vagina. It's not just about that. You need to work on all of it. It's all connected. And so puppy pose and child's pose are really great for that. And I guess another wonderful one is like a supported butterfly where your
Yeah.
knees are apart and your feet are together. And you can do that seated, sitting up nice and tall with maybe some pillows under your knees, or you can lie down on your back in what's called Supta Baddha Konasana, which is like a butterfly of your legs and your hips, feet together, knees apart, but you're lying down on your back. And the best tip I can give you is, even if you're super flexible, it's so helpful to put pillows
Yeah.
or yoga blocks or whatever
Yeah.
underneath your knees for support.
Yeah.
Because even if you're so flexible that you can flop your knees all the way to the ground, your pelvic floor muscles can still be tight and they
Yeah.
can still be hanging on for dear life. In fact, a lot of people who are very flexible in their joints actually have tightness in their pelvic floor, because their pelvic floor is trying to kind of keep everything together. And so supporting yourself so that you feel really safe in your body and your pelvic floor can really just let go is really helpful. So just get comfortable and feel super comfortable in these stretches and super supported and held. And that will allow all of your muscles to just soften.
Yeah. The last one I always recommend, and what I do is, because I also do almost everything online.
Yeah.
And then I have a mattress behind me, and then I can lay down, and then I show them what I do, like with the butterfly, with the cushions up by my knees, and also a little bit with my hips.
Mhm.
And then they say to me, "Oh, when I do it without, then it is pulling everything. And when you get the cushions behind, or the yoga block, whatever, you put it there, then and even I suggest do it a little bit before. If you think you can do like this, do
Yeah.
like this,
Right.
because
Right.
then you can relax into it.
Mhm.
And I think that is really, it's a sort of, um, for me, it's an easy exercise. But the second thing that is also good about it is that many women with vaginismus have problem of opening up,
Right.
because they are afraid, because it's really vulnerable.
Very
But
much.
doing the exercise, like yoga exercise,
Mhm.
then in the same time, they think, oh, it gets better, better, better. And when in time they are wanted to have intercourse, or wanted to have other exercise, to do exercise with the partner, then they notice, oh, before I didn't dare to do that, Jacqueline, even with my partner. And now I dare, because they are used to that it is sort of normal to do like this.
Right.
And that is also the reason why I like that exercise.
Yeah. And another
Yeah.
tip you can do is, in that stretch, like that butterfly stretch where you're supported and you're allowing yourself to be relaxed, is you can cover yourself with a blanket or something if it feels too exposing, even in a
Yeah.
private room, even
Yeah.
in your home, it can
Yeah.
still feel like a lot. So you can cover yourself and you can start to just touch your own body, like
Yeah.
touch your own inner thigh, just your legs, just touch
Yeah.
your legs, just
Yeah.
gently touch your own body. And that can help you learn to be with yourself again. It's an embodiment tool to get in your body and feel safe, because you're doing it yourself. It's not somebody doing it to you. You're doing it yourself. And you just very gently begin touching those safer body parts, like your legs or your knees or your ankles,
Yeah.
before even getting close to touching your vagina.
Yeah. Yeah. And I think that what is nice about the exercises is that they also get more familiar with their body.
Yeah.
When you notice that you can, with the relaxation of the exercise, and you feel that the muscles get more relaxed or more soft, maybe that's also a nice word, more soft,
Mhm.
and they know how to do it by doing the exercise,
Mhm.
they can also use it doing, when they do some exercises what I give them, with all the techniques I give them, and they are really, if they hear it and they say, "Oh, I never thought about how to do how to allow a finger in that way. That is really a soft way." So,
Mhm.
but when they notice that, oh, I can relax now in that area
Yeah.
because of the exercise of the yoga,
Mhm.
and I can put it into the exercise I give also from you, and then they feel they. I think it's not a good word to say control, but I don't know the other word in English.
Yeah.
It's not. It's that you decide. You decide. You can decide more, and you
Yeah.
can arrange more from in your body than you noticed. So
Yeah.
because you can find out how to get your breath in your belly, because when the breath is in your belly, especially in the lower belly,
Mhm.
then your body feels safe.
Yeah.
If it is like here, most of the time, it's not a good time to allow something in your vagina when it's here, because
Right.
on what reason, it doesn't matter what reason, but on what reason at that moment, you feel not totally safe. And then the vagina is saying no.
Mhm.
And I think that the vagina is really wise,
Yeah.
really wise.
The vagina tells the truth. The vagina
Yes,
cannot lie. It tells us
yeah,
exactly how we're
yes,
feeling and what we're
yeah,
thinking.
yeah, yeah,
It
yeah.
will tell
And
us.
yeah,
Yeah. And as you're saying, I think a word that I would use is self-agency. Like we have, it's it's a sense of control, but it's also we have agency when we get to know our bodies
yeah,
through things like yoga. It gives us more agency. Like we're able to say, almost like advocate for our own needs and know what we want and know what we don't want and know what's a yes and know what's a no. And we know how to help ourselves and what feels right and what doesn't.
yeah.
So, yeah.
And that is um what I think that it's really, really sad to have vaginismus or painful intercourse. It's really sad. But if you allow yourself to get more familiar with your body, get more in touch with your body, feel more pleasure with your body,
Mhm.
get to set more boundaries,
Yeah.
um, and to learn that kind of thing. So many times I hear from the clients, and I found out myself also, is that my life changed totally from vaginismus to having nice, pleasurable intercourse, and for my clients also. So afterwards, not during, afterwards, you say, oh, I have different contact with my body. I know more about myself. I can put some boundaries. The relationship with the partners is almost always very good, because they need to talk.
Yeah.
Otherwise, and they need to talk about sex, because doing that, I coach them, they have to. And then when you can talk about this kind of vulnerable topic and
Mhm.
about how you feel, it's a little bit easier to talk about other topics in the
Yeah,
relationship because
for
of
sure.
this.
For
And I
sure.
see that is what I found so great to see, how the woman blossom
Yeah.
during the coaching. And
Mhm.
once one of my clients had a meeting with her boss, and her boss said, I don't know what you do the last few months, but still go on, because you became so open, so friendly, and you talk to everybody. And then she said, Jacqueline, is this about what we are doing together? And I was saying nothing. And because she could answer herself, she
Yeah.
says, yeah, this is it.
Yeah.
Because it's not that almost all women with vaginismus who come with me are really great, educated, lovely women. Many women have high educations. They are really good in the profession, and they have this.
Yeah.
And, but still, no, this part of this influence also the rest of the life.
Yeah.
And when you can solve it together, or they do the work, I do my part, but they do the work, it's really nice to see what changed in their lives,
Yeah.
uh, in general, but in sex life, in everything.
Yeah.
I think it's really great job to do. And many people say to me, it's really difficult. It's a heavy topic, but I love so much with the
Yeah.
clients. I think that you did too. So
Yes.
like, because it
Yes.
is also funny when I lay down on the ground and give some positions or what they can do, or tell
Yeah.
everything, then you also can laugh
Yeah.
about it, even if it is a really serious,
Right.
vulnerable topic. Yeah.
Yeah. Yeah.
Even kijken. Sorry, I talk in Dutch.
You should probably
Do you-
wrap it up, actually.
yes, yeah. Do you have one? Do you have another one tip at the end for the women?
I think I think you wrapped it up really beautifully in what you were saying just before, in that I think my tip is that the more you drop into your body and get into your body and understand and get to know your body through this work, I mean, this can actually be a real gift, is to learn how to get to know your body because of challenges like vaginismus, because it will truly change your whole life. And it will potentially, if you can potentially really enjoy it, you can potentially
Yeah,
get a lot out of it and become a healthier person, a person who understands yourself more and really loves yourself more,
yeah,
if you are able to take that type of mindset. So I mean, I guess that would be my last tip, is
yeah,
to just go with it, be consistent, and know that sometimes when you get started on a program to treat your vaginismus, or stretches, yoga, etc., to treat your vaginismus, it can hurt at the beginning and it can be
yeah,
painful at the beginning, and you can maybe overdo it at the beginning and it can flare you up at the beginning. But the more you are consistent with it, the easier it will be, and the more you'll get to know yourself, and it will actually be the beginning of a really beautiful journey that impacts all areas of your life. So my last tip would be keep going. Keep
yeah.
going, keep going, keep going.
Yes. And I think you mean that um, the painfulness is in the muscles around. It's not the muscle. It's not by painful putting a finger inside you that is painful. It is like what I told you. Like my hips, sometimes when I do the exercise, still
Right.
do a little bit of pain. That is the
Yeah,
pain you. That is the pain you mentioned. Yes.
right,
Yeah.
for sure,
Yeah.
for sure.
Yeah.
Yeah.
Yeah. And so what I will do is I put the link to your YouTube channel in the show notes,
Yeah.
and I will put the 3 exercises that you talked about, like the name. I put it also in the show notes so people can find them and they can Google on the exercise. But better for the people who watch us now, to go to your channel and find out the
Yeah.
different kinds of videos you have, because they are all very beautiful.
Thank
So
you.
I want to thank you for today. It was really nice, and to hear especially the explanation also from the muscles. It's
Yeah.
really nice to hear, and I hope that the women who are watching it are going to your channel to do the yoga.
Thank you so much.
Yes. Okay.
Bye.